This one has, that one has a lot of things on it, the Legend. This one has interferential, portable NMS, pre-mod, and medium frequency. So it has 4 options. It touts it as muscle, medium frequency and interferential, but we'll see the different options. But it also has 4 jacks, so you could conceivably treat 4 patients at the same time, or at least 2 patients, depending on what you're doing. You know, you've only got 1 screen, so that's kind of the downside of it, but you could do multiple treatments. So we have a side A, which are these 2 jacks, and a side B, which are these 2. And unfortunately, we've lost the other one of these. I haven't been able to find it anywhere. These are like little dummy switches. Most of these, if you don't have the pads in contact with the patient as a safety default, it shuts off and waves at you, we're not making good contact kind of thing. With these plugged in, you could work everything on the machine without being hooked up. You know, to play with it a little bit more. I think somebody's plugged up, but we've lost the other one, so I don't know where that one's gone. Okay, so for this one, since we got our pads plugged in here, we would need to choose side B. And then with side B, we get 4 options. Interferential, pre-modulated, Russian, which is your medium, and then VMS. Can't tell you what VMS stands for. It's a Chattanooga acronym, the company Chattanooga. I've contacted them, I've looked on their website, I've looked in the book, everywhere, and it just says VMS. It never says what VMS stands for. So it's got to be something muscle stem, but don't know. VMS is a biphasic symmetric, so it's like a portable NMS unit in a big machine. It's not medium frequency. We'll talk about that more when we get to medium frequency. We're going to do interferential today. Okay, so we choose that button. And it says, yeah, you want both channels because we're doing interferential. Yes, that's right. For the others, it would have given you channel 1, channel 2, both options. And then it gives you 4 presets that have been saved within the computer. If you want, if everything in there is what you want, then choose one of those presets and go. All right? It gives you the rate range. It gives you how long it takes to go from one end of the range to the other. It says whether you're scanning or not, and your treatment time. So if that's everything you want, punch that preset and off you go. If you want to make changes or do your own, then choose custom. Okay? With custom, then it gives you those choices. First it gives you, it says frequency mode, sweep, fixed, or there's my high-low. Okay? Sweep means it's a rate range, and you choose the high and low ends for that. Fixed means it's a value and I just want it at 2 pulses per second or 80 pulses per second. Okay? So if I have it on sweep, then it gives you high and low and you choose your parameters. It defaults to 80 to 150. If you want something different, then you choose. And wherever it's white, that's what's highlighted. Fixed, those go away and you just have a fixed value. Okay? Now the way these work is not an up and down button. Let's say I didn't want 80. And it does hers, but pulses per second. Let's say I wanted 100 for whatever reason. I come over here to my keypad, 100, enter. Now it's saved 100. So that's how you'll change the values, is by using your keypad, making sure to hit enter so it saves it. Okay? If I wanted sweep, then I choose my low, my high, and it gives you an option for how long it takes to sweep from one end to the other. The range is from 5 seconds to 60 seconds, and I can't give you an absolute answer for what to choose, but typically the quicker things are changing, the more irritated it is to the tissues. So for more chronic conditions where we're wanting to get in there, I might use a shorter time because it's changing then rapidly. A more acute, where I'm trying to be gentler and I want it to gradually change, then I might go on the longer end of that sweep time. But exactly what number to use, can't tell you, but that's kind of the time for the idea that you're looking at. Okay? Scan defaults to off, so it'll just be static. Okay? If you want to scan, then you choose what percent. Do you want to do 100% of the area, 20%, 50%, whatever? And same thing then, it lets you choose how long to scan that whole area. Real quick or real slow. And you choose there. And then once you've filled out your scan, then you hit done. Okay?
So
Time?
So you can scan and sweep at the same time?
Correct.
So it'll
Scan is
change
area.
intensity as it moves around.
It will change rate
rate
as it moves around. Yes. They're different animals.
entities.
Frequency time, it defaults to 10 minutes. If I want 15 or 20 or whatever, change there. And then, the base frequency, carrier frequency defaults to 4,000 hertz. You can change that if you want to, but that's kind of fine to keep with that. Okay? If you knew you were going to be seeing this patient, and this was kind of a routine setup, you could then save what you have set up here as one of the presets before. And then the next time they come in, they're preset 2. Boop, if somebody hadn't changed it. Okay? And you can restore the presets and go back. Okay? Once you've got all this set, or if this isn't what you're wanting at all, you can exit out. But then you hit continue. You haven't started anything yet, though. You're just kind of setting it and getting it ready. When you hit continue, then it kind of sets up here what you've chosen. It's not till you hit start that it's actually going. Okay? Now the output range, just leave it on high. It lets you choose low, medium, or high. All that's doing is saying how high is high with the knob for your intensity. So if you want 5 milliamps to be the highest you could possibly go, then you would choose low. You're going to go by desired effect, so might as well leave it the maximum it can do. You know, it's not going to make it higher, it just gives you options of going higher if you so desire. Okay? This also shows your intensity here, channel 1 and channel 2 on a bar scale after you start turning it up, and your balance between channel 1 and channel 2. On this machine for interferential, this knob does intensity for both channels. This knob where it says balance is balance between channels 1 and channel 2. On some of the others, like for medium frequency, this is intensity for this channel and this is intensity for this channel. But for interferential, this is intensity, and you'll see both of them adjusting as we turn up. Right? Yeah, see it's saying, I'm not attached. It's waving at you. It has quite a personality. And then this would be our balance. So see, we can turn it more over toward channel 1, more over toward channel 2. Now, if you're scanning the area, you don't need to do that. But maybe you set it up and they go, well, you know, that's not right where it's at. Okay. Is that a little better? Oh, what about that? And they go, oh, yeah, okay, that's it.
So you don't have to move.
So you don't have to move pads around. You can just adjust it, and then that becomes the originating point of interference. Okay. We usually start with in the middle, adjust if you need to. Okay. Once you get it going, you can look at your status. It'll go back to the main side A, side B screen, but you can punch your status button over here and it shows what you got going on. It shows and you can modify things. You can add treatment time, you can change your scan percent, things like that under status. And it doesn't matter whether you do channel 1 or channel 2 for this because they're both doing something. Just make sure you're on side B instead of side A. Okay? Once you're ready to go, everything's set up. These are set up so that red is one channel and black is one channel. So don't set up red-black as a channel. Red-red's a channel, black-black's a channel. Because you're looking here. Okay, so to set that up interferentially. These can plug into the reusable electrodes, or there are electrodes probably down under that are the sponge ones too. Yeah. They're there, and there are some big rectangular ones too, if you wanted to use those for reusable with the wet sponge and gauze. Okay. Once you get it set, then you hit start, turn it up to the desired intensity, and there you go. This has a stop button, that's the exit. Once you hit start, this will say pause. Then you can pause it, do what you need to do, hit resume. Okay? You can exit, you can stop. A couple other things on this machine. One is setup. Setup really kind of helps you with the view of everything. So it lets you change your speaker volume for the beeping or whatever. So it's on medium now, but it'll tell you high, and we're off, low, medium, high. So it just changes your volume for that. It lets you see whether you want the contact to be at barcode or a dot mode. You can change how it's displayed. And your screen contrast, if your vision, your lights, whatever, you need it lighter, you need it darker, then you can change that. Here's where you restore the presets. If you saved one, you want to go back to the original. You can customize the main menu, so you could put the name of your clinic, you know, whatever on there to make it look all spiffy. Okay? That's setup. Library is one I love. Okay? The library is great for patient education, and it gives you all kind of topics that then we'll kind of display here on the panel. So if you're treating piriformis and the patient has pain down the back of their leg, sciatica, but it's coming from a tight piriformis, and you need to explain to them why you're messing with their butt when it's their leg that's hurting, then you go to, I think it's lumbar spine, yeah, piriformis muscle. Here's your piriformis muscle. It's under your butt cheek. That's the sciatic nerve going through, yada, yada, yada. Okay? So it's just a nice little thing. It talks about, you know, nerves and muscles and whatever you go through. It's just got the sacral plexus, your sacrum, your sacroiliac, your lumbar spine. Gives you a lot of options there. Okay? Questions? Sir?
For the intensity on this, as we're ramping it up, what are we aiming for? Just what is most comfortable? What is...
Yes and no. You go back to your desired effect based on what you're treating. Okay? So if I'm treating a sensory phenomenon, like pain, then I just need a comfortable sensory. If I'm treating edema and I'm not muscle pumping, maybe it's in a joint, then I just need comfortable sensory. If I'm going for that muscle spasm, then I'm wanting motor, but that's where I'm like, you're not going to see or feel motor. So that's where you go for the strong but not uncomfortable sensory. It's above just I can feel it to, yeah, that's pretty strong, but it's okay. Then you pretty much have an idea you're in motor without being able to see or feel motor. So you're still thinking motor. I want you to verbalize motor, that's what you're going for. This reads in milliamps. But say I won't be able to see or feel it, but I'm going for motor, so I'm going for strong but not uncomfortable. Okay? Anything else?